Hi guys, welcome to my channel Medicine Ki Pathshala. I'm Dr. Manali. So today we will talk about varicose veins. All right. Today we'll be talking in detail about its types, how and why does it occur, when one should get serious about it, how do we diagnose varicose vein, what is the role of physiotherapy in varicose vein, what are the other modes of treatment, what is the dietary intake, and things to avoid when one suffers from this condition. All right, so let's quickly get started. So what is varicose veins? See, these twisted, these swollen and enlarged veins, which are blue or purple in color, these are varicose veins, right? See, usually this varicose vein can occur anywhere in the body, simply because veins are everywhere in the body, right? Can you see the picture here, right, of this body? These blue color blood vessels are called veins. Fine. Inka kaam kya hota hai? The role of this is to carry blood from the extremity towards the heart. All right. So these veins are everywhere in the body, right from your arm to your neck, abdomen, everywhere, which means varicose veins can occur everywhere in the body or anywhere in the body. Fine. वो arms पे हो सकते हैं, वो abdomen पे हो सकता है, वो legs पे हो सकता है, कहीं भी हो सकता है. But lower limbs are very common. Simply because pressure, right? Varicose vein क्यों होता है? Because of more pressure on the veins, right? और lower limbs में सबसे ज़्यादा pressure होता है. Whether you're standing or sitting or doing any activity, there is loads and loads of pressure on the lower limbs, right? So simply because of this reason, varicose vein is very common in the lower limbs. All right. Second important thing, varicose vein may occur in one leg or both legs. जरूरी नहीं है कि दोनों legs में हो. All right. Can you see a picture of this lady here? Her right leg is completely fine, but there is varicosity in her left leg. Understood? So, number one, varicose vein can occur anywhere in the body. And number two, varicose vein can occur in both legs or in one leg. All right. Legs में भी वो कहीं पे हो सकता है. It can be on the ankle, on the thighs, under the knee, on the shin part, anywhere. All right. Now let's talk about कि ये क्यों होता है. How it occurs and why it occurs. Fine. So let's थोड़ा सा डिटेल में जाते हैं, थोड़ा फिजियोलॉजी देखते हैं. So we'll get to know. All right. So these are the normal veins. As I said, veins का काम होता है to carry the blood from distal area to the proximal area. ठीक है. Veins usually carry impure blood. Okay. There are arteries which carry pure blood from the heart to the extremities. Fine. Now veins have got valves. Okay. Veins have valves which are one way, which means the blood can travel only in one direction. Can you see the arrow here? Okay, this arrow indicates the direction of the blood. Okay, the blood only travels from the distal part to the proximal part. Okay, and if the walls of the veins become overstretched or let's say less flexible, just like an elastic, then these valves get weak. ये valves को हम easy term में बोलेंगे gate, right? So if the gates are not working, यूजुअली वाल्व्स का काम होता है कि जो ब्लड फ्लो है वो एक ही डायरेक्शन में जाएगा, नीचे से ऊपर. फाइन. बट फॉर सम रीजन लेट्स से द वाल्व्स आर नॉट वर्किंग प्रॉपर्ली, सो द डायरेक्शन ऑफ द ब्लड फ्लो विल चेंज. कैन यू सी द राइट एरो हियर, द रेड एरो हियर? नाउ इट इज फ्लोइंग फ्रॉम द प्रॉक्सिमल टू द डिस्टल, बिल्कुल उल्टी दिशा में. Understood? So because of this, what happens? The veins become enlarged, they become swollen, and they become twisted. So these types of veins are called varicose veins. Understood? Again, for a simple reason, थोड़ा और easy समझाने के लिए एक और पिक देखते हैं. This leg, can you see? It's a normal leg with normal veins. This is a normal vein जिसमें direction एक ही है. This is the varicose vein. The other leg is having varicose vein जिसमें direction of the blood flow has deformed just because of the weakness of the valves in the veins, and the veins have become swollen. Okay. So what are the reasons of varicose vein? Number one is weakness of the valves. Understood? Now, why these valves become weak? Do you know that? Let's talk about it. Okay. अब ये valves क्यों weak हो जाते हैं, varicose vein क्यों होता है, in short risk factors क्या हैं, causes क्या हैं? Let's talk about that. Okay. So let me tell you very frankly, in many cases the reason is still unknown. The experts are still not able to identify that why does the valves become weak. All right. So actual reason अभी unknown है, but there are certain potential risk factors. Let's talk about that. So number one is pregnancy. Now how? Let's talk about it. See, pregnant women have much more blood in their body. Fine. So what happens is this places extra pressure on the circulatory system. Simple. The other reason is, as the uterus grows, there is more pressure on the veins of the mother's pelvic area. So all these things give pressure on the lower limbs veins, resulting into varicose veins. But the good thing is that varicose vein usually goes away after pregnancy, but in some cases it is left visible. केवल visibility दिखेगी, जो हमने बताया था, हो सकता है कि ऐसे दिखे, लेकिन पेन या जो भी दूसरे सिम्टम्स होते हैं वो आफ्टर प्रेगनेंसी लेडीज को नहीं दिखेंगे. फाइन, सो दिस इज अ गुड थिंग. Second, what are the other potential risk factors? The second one is gaining weight, that is obesity. If you're obese, then obviously you're giving much more pressure in your lower limbs, resulting into weakness of your valves. Understood? Resulting into varicose vein. Number third and important one is job. Like if you have prolonged standing job, for example, doctors, nurses, athletes, pregnancy, traffic police, teachers. Okay, so these people are prone to get varicose veins. This is very important. The next factor is age. For example, your age is above 50. So there is more wear and tear on the vein valves, resulting into higher risk of varicose vein. And the last one is family history, genetics. For example, someone in your family had varicose vein, then you are likely to suffer from the same condition. And menopause, of course, because of hormonal changes. Fine. So इन सब से पता लगता है कि जेंडर में भी पता लग रहा है कि फीमेल्स में ज्यादा होता है. See, it's don't misunderstand कि सिर्फ फीमेल्स में होता है. Varicose vein is also in males, obviously, because veins तो उनके पास भी हैं, but more common is in females because of hormonal changes, because of pregnancy and all those things. All right. Now let's talk that when one should get serious about it. कब डॉक्टर के पास जाना चाहिए? See, why am I telling you? It's simply because if the patient has no symptoms and if he has, if there's no discomfort, right? And if she's not bothered even with the sight of the varicosity, अगर उसको appearance varicose का मैंने जो first pick में बताया, if she's not bothered for that too, then treatment is not necessary, because not every varicose vein is severe. You know, कोई कोई varicose vein में आपको कोई symptoms नहीं दिखते, कोई pain नहीं होगा, there would be no spasm, you know, no heaviness, nothing. Only the appearance would be ugly on the legs. So if at all there is no problem, then we shouldn't be bothering varicosity at all. But if the patient addresses of certain signs and symptoms, what are the signs and symptoms? Like pain, like heaviness, like itchy skin, like leg cramps, like swelling. So in all these conditions, the treatment is necessary, it is compulsory. All right. So with this, let's talk about the signs and symptoms. So number one is pain and heaviness. The patient will complain of pain and heaviness. There would be leg cramps, especially जब वो अचानक से उठेगा patient तो उसको leg cramps मिलेंगे, उसको spasm दिखेगा. Restless leg syndrome होगा. There would be swelling around the ankle joint. The skin might even get discolored. The skin will become dark. The skin will become very hard and leathery. Now, why did all these things occur? Skin क्यों dark हो जाती है? क्यों हमारी skin एकदम hard हो जाती है? Why itchy skin? Very simple reason, because of poor blood flow, right? The blood flow is weak, so there would be poor circulation of oxygen and nutrients. Fine. And to the skin there would be itna less उनको oxygen and nutrient मिलेगा. Plus जो भी waste products हैं, they will not get flushed out, so resulting into the darkness of the skin. So these are the signs and symptoms. If at all these signs and symptoms one suffers from, then one must go to a doctor. Now what if ये सब हो रहा है फिर भी हम लोग फिर भी we are not going to a doctor, then what happens? Then the varicosity becomes very severe. How severe? Let's talk about it. वो इतनी severe हो जाएगी कि आपको blood clots हो जाएंगे thighs में. Can you see here? These are blood clots. Now just imagine अगर इनमें से एक भी blood clot gets dislodged and through the bloodstream it travels into your heart, then you might also suffer an heart attack and you may even die. So can you imagine how severe varicose vein can become? So that is called thrombophlebitis, that is in simple language blood clots. Number two is chronic venous insufficiency. Can you see the darkness? Can you see the discoloration of the skin? Fine, this will occur. यानी आपको blood पहुंच ही नहीं रहा legs में, आपके पैर necrosed हो सकते हैं. You might even go for the amputation of your lower limbs. तो because there is no blood supply, there is no nutrient, nothing, तो सड़ सकते हैं पूरे, necrosis हो सकता है, सड़ सकते हैं. So how severe this can get, you can imagine. You might even suffer from bleeding. See, can you see the tropic ulcers here? Bleeding क्यों होगा? Because healing जल्दी नहीं होगा. Healing क्यों जल्दी नहीं होगा? Because जो vessels हैं, जो skin है, उसको nutrition पहुंच ही नहीं रहा, उसको oxygen हो ही नहीं रहा. These two are very much responsible for faster healing. वो सब हो ही नहीं रहा, then obviously you might suffer from आपको कोई भी थोड़ी सी भी injury होगी तो आपको ulcers हो जाएंगे, आपको bleeding होने लगेगी. So this is how the severity of varicose vein can lead. Okay, there are certain types of varicose vein depending on the appearance: spider veins, reticular varices, varicose vein trunk, chronic venous insufficiency, and trophic ulcers. All right, ये सब appearance के after the appearance they are named. All right, now let's talk about the diagnosis. Now you must be feeling कि अब varicose vein अच्छे से दिख रहा है, we are signs and symptoms अच्छे से दिख रहे हैं, then why we should go for diagnosis? But diagnosis is very important because we should know, one should rule out that how severe the varicose veins are. See, आपको तो superficially दिखा है, you can only it's only visible superficially that yeah fine, there are purple patches, there are blue patches, I could see the swelling here and all, but internally, in deep down there on the tissues and all, क्या हालत है, you really don't know. For that, diagnosis is important. Okay, कोई हाइफन डू टेस्ट नहीं है, सिंपल अल्ट्रासाउंड स्कैन करेंगे, अल्ट्रासाउंड से पता लग जाएगा क्या क्या. लेट्स टॉक अबाउट नंबर 1 is Doppler test. Through Doppler test, one can check the direction of the blood flow, the blood clots, and the obstruction in the veins. There's number 2 test, that is color duplex ultrasound scan, through which one can check the speed of the blood flow. All right, now let's talk about the treatment. Physiotherapy, that is number 1 treatment, that is the most essential treatment. There are certain exercises, there are certain positioning, क्या करना है क्या नहीं करना है. Physiotherapy से there are so many cases which I have personally seen, which I have personally got cured under me. So physiotherapy is the number 1 essential thing. And number 2 is surgery. If at all condition बहुत ही खराब हो चुकी है, बहुत ही severe हो चुकी है, then one must go for surgery. And these two are must. Compression stockings अगर आप physio ले रहे हैं तब भी लगेगा, और अगर आप surgery करवा ली है तब भी compression stockings तो पहनना ही है. What are compression stockings? These are a type of socks which are long socks right from the ankle to your knee joint, which one needs to wear. So what happens it will give compression to the muscles, to the veins, to the pulse, which will eventually improvise the blood circulation by the pumping effects. So this compression stocking is a must in any type of varicose veins. Number 2 is dietary intake. Yes, it plays a good role in preventing as well as in curing varicosity according to certain studies. We'll talk about it in detail. But before that, मैं थोड़ा सा कुछ बता देती हूँ कौन सी ये types की surgery के बारे में. So number 1 is laser therapy. What happens with it? So in laser therapy, a focused beam of light is used to treat the varicosity. Sclerotherapy, what happens? They inject salt water solution into these abnormal vessels, and this will help the vessels or the veins to collapse. Okay. Number 3 is radio frequency ablation. इसमें क्या होता है? Removal of the tissue is done using the heat from an electric current produced by a radio wave. Okay. The next is ambulatory phlebectomy. इसमें removal of a part of tissue, or let's say removal of superficial veins are done through small slits on the legs. And in vein stripping, the entire vein is removed. All right. So this was all about surgery. I won't be speaking much detail into it. मैंने आपको थोड़ा सा brief knowledge दे दिया है किस type of surgery में क्या होता है. In detail, we'll be talking about the physiotherapy management. Let's talk about it. So as I said, 2 types of management. Exercise therapy भी होती है, साथ साथ में positioning होगी. आपको कैसे पैर रखना है, कितना elevated रखना है, क्यों elevated रखना है, all those things are explained in physiotherapy. Here I'm giving you generalized exercises because the exercises of physiotherapy depends from person to person, depending on the severity of the varicosity, कितना severe है, कौन सा ग्रेड है, उसके ऊपर से एक्सरसाइजेस होती हैं. सो यहाँ पे मैं जनरलाइज्ड एक्सरसाइज बता रही हूँ, which is done by anyone or everyone who are suffering from varicosity. So number 1 is warm up. Simple warm up. You don't have to do any exercise. It is just a lying posture. You need to lie down. Your legs should be against the wall. Simple thing is you don't have to do any movements. Your body should be at the right angle with your trunk, and you just need to lie down for 5 to 10 minutes. What happens it? The anti-gravity position हो गया. So simply the blood will flow from higher medium to the lower medium without any efforts given by valves or your veins. So you are actually giving relaxation to the lower limbs. All right. Number 2 is exercise in line. Okay, one is straight leg raise and one is cycling. These two could be done 5 to 10 times depending upon the severity. The physio will be able to tell you properly. Number 3 is exercise in standing. There's one in which you need to heel raise. The patient has to, stand against some support. Number 2 is squats, very important, very effective exercise. But squatting, the position in squatting is very important. You should not be slouching. Your back should be straight. Otherwise, you will unnecessarily welcome knee pain and back pain. So this is how you do squats, in which you are strengthening up your weakened muscles and weakened veins and valves. And last one is cool down exercise. It is again a relaxation exercise in which the position is same as the warm up exercise. All right. Now positioning. Positioning is very important. Why? Because you have to keep your legs elevated. Only then it would be anti-gravity, number 1. Number 2, only then the blood will be easily able to flow from your legs towards your heart. Okay. So how do we position ourselves? Number 1 is on the bed. How? You need to keep 2 or 3 pillows under your legs. Your knees, your calf muscles and your ankle, all 3 should be properly supported. It shouldn't be like this. यहाँ पे दिख रहा है आपको बिल्कुल leg straight है और केवल calf तक ही support है, knees में support नहीं है. So this is a wrong position. Number 2 is positioning on the chair. Can you see? Let's assume this is the affected leg. The unaffected one is lying there. It is on the floor. It is not hanging, right? It is firmly placed on the floor. The affected leg should be kept on 2 or 3 pillows on the stool, and again the knees, calf and these all 3 should be properly supported, plus the knee joint should be above the hip level. All right, only then the blood will be easily able to flow, right? It shouldn't be down there. Agar aap ye down kar rahe ho, then it is actually useless. Okay, so try and place it either straight or above your hip level. All right, so this was all about positioning, which is very important. Okay, I forgot about telling you something about surgery. सर्जरी का थोड़ा मैं डिस्क्रिप्शन दे देती हूँ. जो आपकी जो सर्जरी है ना, वो अंडर जनरल एनेस्थेशिया होती है. जो पेशेंट होते हैं दे एक्चुअली गेट डिस्चार्ज इन द सेम डे. उनको कुछ बहुत दिनों का स्टे नहीं करना पड़ता. अगर बायलेटरल है, अगर दोनों लेग्स में सर्जरी करवाई है, देन दे माइट हैव टू स्टे बैक फॉर अ डे. All right, and after surgery it is very much necessary that patient needs to take rest at least 1 to 3 weeks to recover, and during the recovery time the compression stockings are worn, and after the surgery also physiotherapy is required. So can you imagine how essential physio is? आप सर्जरी करवाओ या नहीं करवाओ, फिजियो चाहिए. सर्जरी करवाएंगे फिर भी फिजियोथेरेपी चाहिए, कंप्रेशन बैंडेजेस भी चाहिए. Okay, now let's talk about the dietary intake. Very important. Now, what are the dietary intakes? क्या क्या खाना चाहिए, क्या क्या नहीं खाना चाहिए? Let's talk about that. All right. So flavonoids. What are flavonoids? Flavonoids are onions. They are lemon, tomato, cucumber, mushrooms. These are flavonoids. Okay. These flavonoids improve the blood circulation. They decreases blood pressure in the arteries, relaxing. They relaxes the blood vessels. So what happens is all these are required to reduce the varicose vein. So eating flavonoids is very important. Number 2 is fiber-rich food. क्रोनिक कॉन्स्टिपेशन की वजह से भी वेरिकोज वेन होता है. बिकॉज जिसमें कॉन्स्टिपेशन होता है ऑब्वियसली, तो आपके जो एब्डोमेन एंड बिलो एब्डोमेन आपका प्रेशर बढ़ेगा, रिजल्टिंग इनटू वेरिकोसिटी. सो one has to be free from constipation. For that, fiber rich food is required. Water foods have fibers in it. Can you see the pictures? Bananas, seeds, flax seeds, these oats, strawberries, cherries, coconut, these all are very rich in fibers. One must have that. Number 3 is potassium rich food. Potassium can help reduce water retention. So one should have potassium rich food. Which are they? These are spinach, potatoes, bananas, avocados, beans, fish. There are certain types of fish which are rich in potassium, like salmon, like tuna. So have them. Nuts, almonds and pistachios, these 2 dry fruits are a must if you are suffering from varicose, or if you want to prevent varicosity. Lentils, garlic and citric fruits. Along with these all foods, you have to have these fruits also. So this was all about dietary intake. This is very important. What to avoid? See, wearing tight clothes. Number 1, wearing tight clothes can restrict blood flow. Very simple. So try and wear loose clothes. Sorry. Number 2 is cross leg sitting. Simple funda, because cross leg sitting hoga, so it may restrict your blood flow and legs and on your legs and feet, so which may again add on to the circulatory problem. So try and avoid that. Salty food, sodium rich food. Why? See, these can cause the body to retain water. So cutting salty food can actually minimize water retention. Also, do you know salty food has sodium rich food that leads to constipation? So try and avoid it. Gaining weight, I don't have to tell you the reason. High heels. So if you are wearing high heels, your muscles, your veins are constantly under strain. So try and wear flats, try and wear footwears, like simple footwears, try and wear shoes. Prolonged standing or sitting. Caffeine, this is very important. Why? Because caffeine constrict the blood vessels. And alcohol. Do you know a high amount of alcohol again leads to constriction of blood vessels? It also leads to constipation, which can again put your veins under pressure. So try and avoid it. So guys, this was all about varicose vein from my side. I have given you जितना detail दे सकना था उतना दिया है मैंने, so that you know a common people can actually understand कि मैं क्या कहना चाह रही हूँ. See, I know this term is quite new to few of you. So please try and share this video. Please try and share to your elders, to you know, to your friends, to your family. क्या पता उनको हो वेरिकोसिटी, उन्हें पता ना हो, लेकिन फाइन. So in a way you are actually helping them out. In a way you are you know, they will actually understand that what is it, and it would be immensely helpful to them. So please try and share this video. So this was all about varicose vein. I hope I was able to, you know, share my knowledge properly. I was able to explain properly what exactly it is. अब आपको knowledge हो गया होगा varicose vein के लिए. So yeah, please you can actually comment you can actually write whatever do you feel in the comment box. Tell me how did you feel. Tell me what topic should I come up with next. अगर आपके दिमाग में कोई और topic हो जो आप चाहते हैं कि मैं explain करूं, please tell me. Okay, and please subscribe to this channel. I need the subscriptions because I really want my knowledge to get shared in a very simple language. I want this to happen. So yes, this was all about me. And this was all about varicose vein. Fine. So next time I'll come up with some more interesting video. Till then, take care and stay safe. Thank you so much.